Welcome. My name is Vicki Bukta, and I'm the Senior Vice President of Care Improvement at the Arizona Hospital and Healthcare Association. In this session, I will be joined by a colleague to discuss advanced care planning and the Arizona Healthcare Directives Registry. Our objectives today are threefold. First, we're going to talk about the importance of advanced care planning for patients and families across the lifespan. We're going to talk about common forms, and we're going to explain the importance of and how to use the Healthcare Directives Registry. We will also touch on some other topics to help reduce fear and stigma, because we know those are alive and well when it comes to the topic of advanced care planning. We're also going to learn how to talk to people about your wishes. Next, I'm going to show a short video that really emphasizes the importance of advanced care planning.
Having a conversation about end-of-life preferences while someone is dying is like trying to tell a teenager about contraception when they're hot and heavy in the backseat of a car. Your emotions are so strong that you really can't make good, rational decisions. Across cultures, people are hesitant to talk about end-of-life for a variety of reasons. Some of it's cultural. But even for the general American culture, we haven't embraced the philosophy of palliative care or helping people have good deaths. Just look at the way that we market healthcare, for example. We market only the successes. The problem is that it programs us to see only life and to ignore that death is a part of life. I think families and patients could benefit by having their wishes known and addressed, because it would empower them. It becomes their health care and not something that they passively receive, but something that they actively advocate for. Not only would individual patients benefit, but we as a society would benefit. It would begin to normalize the fact that these kinds of decisions should just be a part of routine preventive maintenance, like getting a flu shot. Having the conversation is important, but it's not enough. It needs to be in writing, because when emotions are high, you may forget. Maybe the person you've shared those wishes with or your values with isn't around. But if you can put your values and wishes in writing, say for example, a POLST form or advanced directives, something in writing can guarantee that your voice can be heard when it's critical.
This next video talks about who needs to have the conversation. Note that this is a silent video and is about 30 seconds long. We face challenges when it comes to advanced care planning. It's not necessarily a topic of daily discussion, and is something that we're not always comfortable with. Think about it this way. If you have a car, you have car insurance. You don't want to ever have to use it, but you have it just in case. End-of-life matters are very similar. You don't want to think about the possibilities of end-of-life, but we all know that it's imminent, and it is better to plan for it. In Arizona, we have major efforts underway to increase knowledge and confidence about advanced care planning, and to increase the number of people who have their wishes documented. What we know in the U.S. today is studies show that about 1 in 3 adults have completed any time of advanced directive for end-of-life care. In Arizona, according to a survey that was done, 39% of Arizonans report they have completed an advanced directive. And that sounds really good, as if Arizonans are doing better than the rest of the nation. But when the question was actually asked about what sort of advanced directive these 39% of people have, it turns out that 12% have a healthcare power of attorney, and 11% have a living will. So we still have work to do in this area. There are many barriers to discussing end-of-life wishes. Nationally, we know from studies that people report there's just too many other things to worry about right now, or they don't want to think about dying, or loved ones don't want to talk about death and dying. It often seems that it's so far off in the future that there really isn't, it isn't necessary to think about it right now, or they might not have anyone to talk to. And importantly, they oftentimes say that they will trust their healthcare team to make decisions, which we know is not necessarily the decisions that they would want. In Arizona, same survey, the results were very, very similar. 41% of people say they just plain haven't gotten around to it yet for different reasons. They haven't considered it, or they don't think it's necessary. So why and how to begin at advanced care planning? It's uncomfortable when we first think about it, but the benefits definitely outweigh the stress. There are great resources that are available online. The IHI has the Conversation Project that is wonderful, and importantly, they really honor other cultures and have documents that are available in many languages. There is no one single strategy or approach that works for all people. So why do we plan for end of life? We know that 50% of people will become incapacitated and are thus unable to make their own medical decisions. People often think that when they get to the end of life, or when they get to that point that they'll have to make those hard decisions, they will automatically be able to do them. But if they're not, the default is that they will be treated aggressively, even if it's not desired, and even if it's hard for the family to predict the patient's wishes. So ideally, we would really want those people to be making their choices ahead of time. Reasons people become incapacitated include dementia, they might be unconscious, or they just simply are not able to make decisions. We're going to segue now to a short video about advanced care planning conversations.
Whether it's schools or doctors or spouses, I feel that they should bring up this end-of-life discussion early. When he passed, he was 71. We were together 24 years, married 23 years. 6'3", which defined him, his height defined him. And he was a punner. That was another thing that defined him. He would just rattle them off one after the other. He became ill several years ago with kidney cancer and had a kidney removed. And then little by little, the second kidney began to fail. I tried to have that end-of-life discussion with him over the last 5 years, and he was so reticent. He never really was willing to have a conversation. He would say, I don't want to linger, or things like that. And, you know, from that I had to extrapolate. So it wasn't until he was really almost gone that I was able to say, look, is this what you want? It was hard to do. It's not an easy conversation to have. I think it's embarrassing in some ways for even a health professional to bring up. But having the end-of-life discussion documented nails that down, because once you have it, your closest relative has it, your hospital has it, possibly your lawyer has it, you're pretty well covered, and you save yourself worry, you save your loved ones worry, you ensure that you're going to get what you want to get. I think it's a very good idea to start in your mid-20s and just make it part of the everyday conversation so it's not difficult to have.
So how do we get started?
Mom.
Mom.
Dad. 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 Sweetie, can we talk?
Everyone, dies.
So, how do you want to go? Do you have a plan for your end-of-life care? Because I don't. Don't take this the wrong way, but you're not getting any younger.
So I was binge watching Game of Thrones, which reminded me that everybody dies.
Oh. You've heard of a birth plan, right? It's like that. Only the opposite.
I need your help with something. Can we talk?
My biggest fear is losing you, and that I won't know how you want me to care for you toward the end.
Remember what happened to Aunt Maria? I don't want that to happen to you.
You've taken care of me your whole life. Now it's my turn to take care of you.
Oftentimes, starting the conversation is the hardest part. Here are some quotes that you could try if you're looking to get started in starting these conversations. Some that work for me personally are things like, I was thinking about Grandma's death and it made me realize, and then finish the sentence. Or, I just answered some questions after this workshop I went to about end-of-life care planning, and I was wondering how you might answer those questions. Next, we'll move into documenting your wishes. Documenting your wishes is extremely important, along with having a conversation with your family members. They may not remember exactly what you told them, and it's great to be able to refer back to these documents. One thing to remember is that advanced care planning is a process, and that there are going to be different forms and different conversations for different times of your life. So if a person is 18 years old and healthy, and by the way, in the state of Arizona, 18 is the age at which a person can execute advanced directives, they are more than likely going to do advanced directives which are planning for the future. So they're thinking about, if in the event I weren't able to make decisions for myself, what would I want? And that could be 20 years from now or 50 years from now. Generally, they will identify a healthcare proxy or surrogate, and they will have a conversation about their preferences. But then if someone has a diagnosis of a serious chronic illness or becomes seriously ill, there are different conversations that will happen. With a person who is seriously ill, there will be a progression of serious, or there is progression of serious or chronic illnesses. And then they move into crisis or decline. We will want to start talking about end of life issues and concerns. And there are some different forms that we will use for that. So we'll be moving into talking about each of the forms, but advanced directives we think of typically as a living will and medical power of attorney and a mental health care power of attorney. And then there are other directives such as a pre-hospital medical care directive for a do not resuscitate, and POLST for goals of care, as someone might progress with a chronic illness or become seriously ill. So why create a healthcare directive? This is the way to make your healthcare wishes known if you are unable to communicate when the time comes. It allows you to either or do both of the following: appoint a decision maker, which is your healthcare representative, and to state your instructions for future healthcare decisions. Here's a list of the types of forms that are available in the state of Arizona. I will mention first that while we will go over specific forms, Arizona does accept living wills from other states as well as from the Veterans Association. So let's start first with a living will. There's many options that are available. Shown here are 3 of them, and the advantage to the Arizona Advanced Healthcare Directive form is that it is written at a 4th grade reading level and steps a person through the form very, very nicely. The form in the center of this page is a 2-page form which includes everything that one would need to do the medical power of attorney, the mental health care power of attorney, and a living will in a 1-page document that is printed front and back. And then the other option shown here is the life care planning packet, which is published by the Attorney General's office. It is 23 pages long. It is very long and involved, has frequently asked questions, so it is for someone who really wants to understand a lot of detail. It includes much of that detail. The living will is a legal document. It outlines in writing your desires for treatment in the event you're unable to make a decision. It can include wishes for autopsy, organ donation, and funeral planning, but that's optional. It does not have to include that. Sometimes a living will is confused with a will. A will involves distribution of property and money after someone dies, and it is important to distinguish between the two because whoever is named in the will for property is not necessarily the person who can make healthcare decisions. The Durable Healthcare Power of Attorney, or POA, which is what we call this document in the state of Arizona, may also be referred to as a surrogate decision maker, the person's agent, or the person's proxy. Those words are used interchangeably, but we do use Durable Healthcare Power of Attorney here in the state of Arizona. These are people who can make healthcare decisions on your behalf. One of the advantages is that they can make decisions over the phone, so they do not have to be local. And they can make decisions about treatment, including POLST, and their decisions are limited only by the express language of the healthcare directive. They cannot direct EMS to not start CPR, and they cannot complete an advance directive on your behalf. So it's important to choose somebody who can advocate for you and follow your wishes, talk to the healthcare team and ask questions, and is available and ready to accept responsibility. And importantly, you really want to make sure that you discuss your wishes with this person. Next, we'll show a short video about choosing your healthcare power of attorney.
Be your healthcare proxy? Like if you need someone to tell the doctor what to? I just go with whatever the doctors say. I wouldn't want to bother them. They're so busy. Doctors know best, right?
Be your healthcare proxy? Sure, I'd be happy to. If I'm in town, check out my Instagram pics from Peru. Wish you were here.
Oh, I could never let you go. I can't even throw a plant away. As long as it's got one little green leaf. I'd be like, can't we upload her to the cloud?
Well, heck yeah! I've given this a lot of thought. Let me tell you what decisions you're best off going with. You never let them resuscitate you. And if they even try to hook you up to one of those breathing machines, never! I got this! I totally got this!
How can you even talk about this? I can't, okay? I just can't. Mom, it's not like you're gonna die. No, I can't talk right now.
Oh wait, did I show you that meme from iFunny? The cat and the dishwasher? Oh my gosh, okay, so the cat's like, bleh. And then he's like, wah! Oh wait, sorry, what?
Well, hon, you and I have been through so much together. Here's what we'll do. We'll sit down, we'll get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I'd have your back.
I remember when we went through this with Mom, we really spoke for her. So I think I can do that for you. Let's talk about what you would want.
So who speaks for you if you cannot speak for yourself? Ideally, you've named that representative or your healthcare power of attorney. If you have not, there is a list in statute of surrogates in the state of Arizona, and they go in this order: spouse, adult child, parent, and if you're unmarried, a domestic partner, a sibling, or a close friend who knows you well enough to be able to make decisions for you. If you have no surrogates, a physician in consultation with the hospital ethics committee can make a decision, a physician in consultation with a second physician, or a court-appointed guardian. But you really want to think this through, because if you choose to not have a designated healthcare power of attorney, take a close look at that surrogate list and ask yourself if these are the people you would want to be making decisions for you in that order. The mental health care power of attorney is similar to a healthcare power of attorney in that it allows you to authorize somebody to make decisions for you, again, if you're unable to make your own mental health care decisions due to mental or physical illness, injury, disability, or incapacity, including Alzheimer's and dementia. It's important for inpatient care for behavioral health services and can be part of a single document or a standalone document. The Pre-Hospital Medical Care Directive is another type of directive. We oftentimes refer to it as the orange form because it is printed on orange paper. It specifically directs EMS to not start CPR and is also can be honored in the emergency department. It's usually for people who have advanced or terminal illness or are at end of life. It must be signed by a patient and the healthcare provider, must be printed on orange paper, and it should be noted that EMS does not follow a living will even if you stated that you do not want to be resuscitated or your healthcare power of attorney tells EMS your wishes. And that's because the living will is not signed by a healthcare provider, so EMS is not going to follow it. There are some statistics that might help people make an informed decision about whether or not they want CPR. It's important to note that CPR really was designed for people who are healthy, and that for people who have life-limiting illnesses or chronic diseases, especially cancer, the likelihood of survival with CPR is very small. And in fact, even in the hospital, the likelihood of surviving CPR in that setting is about 15 to 20%. The POLST is a process designed to improve patient care by creating a system using a portable medical order that records patients' wishes for treatment. A POLST always starts with a conversation about the patient's values, beliefs, and goals of care. And goals of care can be specific, like, I want to be kept pain-free, or I want to be kept as lucid as possible, even if that means I'm in some pain. Diagnosis, prognosis, and treatment options should all be part of the conversation. A POLST is a set of medical orders that is valid across all care settings, and that's really what sets it apart across some of these other documents. It should only be used for individuals with a serious illness or frailty towards end of life. And we generally talk about that being in the last 1 to 2 years of life. And another important component is that POLST is always voluntary. We actually have had calls from organizations or from people who have been admitted to facilities who were told that they have to have a POLST in order to be admitted to the facility. And again, I want to emphasize, a POLST is always optional and always voluntary. Should never be something that someone is forced to do. The right conversation helps ensure the right care at the right time. Again, this is a depiction of something we saw earlier, but to re-emphasize that advanced directives are planning for future care, and medical orders such as POLST and that Pre-Hospital Medical Care Directive, or DNR, really would be for current care. So really more towards end of life. There is some legislation to keep in mind when it comes to POLST. Generally speaking, our legislation in Arizona is silent on POLST, except for this one piece where it says that if there is a conflict between the POLST and the advanced directive, or what the surrogate says, then the advanced directive or the wishes of the surrogate or the directions of the surrogate would take precedent over the POLST. So with that said, it's extremely important that in order to reduce conflicts, that all documents should align. So at the time a POLST is executed, it's important to update the living will and any other directives to make sure that all are in alignment and ideally are dated at the same time, and that there is a discussion with the healthcare, the durable medical power of attorney. So I want to summarize some key concepts then for POLST. It is always voluntary, as we discussed. It is written only after a discussion with the patient. There is shared decision making between the provider and the patient. A physician, a nurse practitioner, or a physician's assistant can sign a POLST. It should never be done ahead of time by one of those providers and then handed to a patient. And likewise, a patient should not fill it out and then take it to their provider. It should be done in a shared setting. When the POLST is completed, it is considered a set of medical orders, but it is not a healthcare directive. So it does not necessarily take the place of a healthcare directive. And indeed, if it's going to be used, it should be attached to a healthcare directive, and especially when it's submitted to the Arizona Healthcare Directives Registry. And it's important to share the POLST form widely. You'll want to leave a copy with your healthcare provider, who will then put a copy in the electronic medical record so it can go into the health information exchange, and other healthcare professionals will have access to it. You'll want to give a copy to your agent or surrogate so that they know what it is your wishes were. And you want to attach it to that advance directive and submit it to the Arizona Healthcare Directives Registry. So when should you review and update your healthcare directive? There's several key times to do this. Think about it as coinciding with important life changes, such as marriage, birth, divorce, death, with the diagnosis of a major illness or a new diagnosis, maybe a change in treatment plan, maybe we're going from something very aggressive to supportive care, a change in wishes, transfer from one care setting to another, and on a periodic basis. So what do you do with your healthcare directive documents so your wishes can be honored? Well, the first and most important is to make sure that you send a copy to the Arizona Healthcare Directives Registry, or ask your healthcare provider to do it for you. Share your documents widely. We hear often that people they've completed their advance directives, but they're locked up in a safety deposit box or in a safe at home. If they're not accessible, they're not useful. Give a copy to your healthcare representative and make copies for your loved ones. Discuss it with your doctor and get it into your medical record. Keep a copy for yourself and take it with you when you go to the hospital. You don't need to do a new one every time you go to the hospital, but as long as they may have it on file, but it's safer if you take it with you when you go. And then you'll want to register your advance directives and your POLST with the Arizona Healthcare Directives Registry. We've got a little detail here. Just want to let you know that community members may use the public-facing portal, and that hospitals and healthcare providers can make it easier for patients by having the patients give permission and then submitting advance directives on behalf of the patient. And again, the POLST will be included in the directives registry if it's attached to the advance directives. And with that, I'm going to turn it over to my colleague Carla Sutter from the Arizona Healthcare Directives Registry to walk you through a little bit more about submitting those advance directives.
Hi, I'm Carla Sutter with the Arizona Healthcare Directives Registry at Contexture. And I want to spend a little time talking about the Arizona Healthcare Directives Registry that we're going to refer to as the AzHDR. If you do not have access yet at your organization, please work with your manager to be able to get access to use the registry as part of your day-to-day workflow in looking for advance directive documents and in assisting your patients and clients with uploading their documents into the registry. Before we begin, just to give a brief overview, the AzHDR is the state-designated advance directive registry in Arizona. What that means is this is the kind of source of truth for advance directive documents. Consumers, as well as healthcare providers, legal, and community-based organizations are able to assist their clients and patients with putting in their most current version of an advance directive document, whether that is a healthcare power of attorney, living will, mental health care power of attorney, the pre-hospital medical care directive, or if there is a POLST document that is attached to one of the above advance directive documents. Once you have access from your organization, we're going to be referring to you as a subscriber. And as we move forward in the next slides, I'm going to share with you how you can do several of the functions. The 3 functions we're going to talk about is the ability to search the database, view documents that are in the database, and upload documents on behalf of your patient. As I shared, you will have been given access to the registry by way of receiving an email that will allow you to log in and get your credentials. If you have not received that email and you think that you should have, please refer back to your manager, or you can work with our team, and that information on contact will be at the end of these slides. Additionally, once you do have access to your registry login, there will be additional videos available for you on training on how to use the registry in deeper discussion. Again, once you have access, you're going to be able to log in to the registry. Please note that you may have access to some of other Contextra portals, including the Health Information Exchange or the SDOH portal. The AzHDR sits outside of the HIE portal. So this is going to be a separate login and a separate access point to be able to get to the portal. You will have your email from work as well as your password that you have set up to be able to log in to the registry. Once you do, you're going to be able to do a search. You do not need to receive consent from a patient to search the database. And that is because any documents that are in the database have already received consent through a registration agreement that the consumer or their agent has already signed. So again, you will be able to search by name and date of birth any document that has been put into the registry without needing initial consent from that patient. Once you put in the name, last name, and date of birth, you will be able to view if there are documents in the registry. If there are multiple listings or multiple individuals, for example, John Smith, born on the exact same date of birth, but maybe multiple John Smiths, it will give you a notification that there are multiple accounts with that information, and you will need to enter additional details, maybe a middle name, middle initial, street or city where that individual has resided. Once you get to the document, if there are documents in the registry, you will be able to see which forms that individual has uploaded. Here on this screen, you can see that this individual has uploaded all 4 types of advanced directive documents and has also included a POLST document as part of his directives. And so you will see POLST in red attached to his healthcare power of attorney and his living will. You are able to see these documents and view them once you have opened the account. Now, the Arizona Healthcare Directives Registry moved from the Secretary of State, who held the registry since 2004. This was done in November of 2021. We moved all of the documents from the Secretary of State, and so those documents will show in a little different form. You will see those documents that say Secretary of State, and you would need to open up that account to see what documents are held within, in this example, this test example, Mr. Weston's account. Again, this document is now being, these documents that were sent over from the Secretary of State are being reviewed and separated out by type. So fewer and fewer of those original Secretary of State documents are going to show in this manner. Most of the documents will show in this way, where you're going to be able to look at all the different forms that that individual may have uploaded. That is how, again, you're both searching and viewing. But one of the key functions of the registry and of working with subscribers across the state of all types of organizations is that we continue to upload new documents into the registry, as well as new versions of documents that individuals may have wanted to complete. Just because somebody doesn't have advance directive documents showing in the registry doesn't mean they don't have advance directive documents. For example, you may have a patient that comes in, little Bo Peep, for example. You may put her name into the registry and it may show no documents in the registry. But we have to then talk with little Bo Peep to see, does she have an advance directive? She may have advance directive documents, but like many people, she may think that the best place for those documents are in a secure file cabinet in her home. Well, as we know as healthcare providers, that is not the best place for those documents because they are not viewable in the moment of care that is needed. And so this would be an opportunity to talk with Ms. Peep about the registry and then assist her with uploading those documents. The question of seeing whether or not Ms. Peep has documents in the registry may also bring up the fact that Ms. Peep does not have advance directive documents. And now this is an opportunity to share with her a little bit more information about what advance directive documents are, how they can assist her, how they can ensure that her wishes are known, and how they can be uploaded into the registry. Finally, Ms. Peep may have advance directive documents that she's provided to your organization in a previous admission, but they were not uploaded into the registry. This is a great opportunity then to have the conversation with Ms. Peep, share about the registry, let her know that those documents then would be able to be viewed by healthcare providers across the state and not just within the organization that she is being admitted to today, and then be able to work with her on uploading those documents. The reason that we do not simply take documents that are held within the accounts and EMRs across the state and just simply upload all of them into the AzHDR is that the way that the registry statute is written in the state is that it is a consumer-focused program, which means that we do need the permission of that consumer at the time we are assisting with uploading their documents. That is called a registration agreement, and that registration agreement states that they would like their documents in the AzHDR and that they understand that when those documents are submitted, they will be viewable by providers across the state who have access. That registration agreement is always available within the site. You can see that here. It's downloadable. You may want to have extra copies at the admission desk or at one of the nurses' stations so that they can easily be completed with your patient. There is an easier way that these documents, the registration agreement is completed when somebody is doing it through a subscriber and a healthcare organization, because then that document does not need to be notarized. Once you have that registration agreement completed, any one of her advance directive documents or downloading previous versions from your EMR, you're going to be able to upload those documents simply by selecting those files or dropping them in the drop file here space. You're going to add a little bit of demographic information and then upload those documents. As I shared a minute ago, this registry is consumer focused, which means that we have conversations about what documents are being uploaded into the registry at all points with that direct consumer or their agent. So when your organization uploads those documents on behalf of a patient or client, we are going to receive those. Our team at the AzHDR at Contexture are going to review them, make sure that the advance directive documents have been completed in a way that for future healthcare they can be utilized because they have met the statute standards. And then we're going to communicate that information with that client or their agent, letting them know that the AzHDR has received those documents, who they've received them from, so which site they have been received from, and how that individual can now go on and set up their own personal account to be able to view those documents and share information with any of their healthcare agents. One of the other pieces that goes along with the registry is what we call our view-only wallet card. Once documents are uploaded, once they are approved and now available for viewing within the registry, that consumer receives a view-only wallet card that they can print out and carry with them. The URL and the QR code will link back to whichever version is active at the time for that individual. This is something they can carry, and so if they were found in a healthcare crisis and not able to communicate in the community, that individual who has found them would be able to open up their account, but only view their advance directive documents. They can't make changes to that account. They can't delete anything within that account. This card is voluntary to carry, but it does allow for easy access for both that individual, somebody who does not have direct access to the portal, and their agents. This is a great card for an individual to give to their healthcare agents so that no matter where that healthcare agent is in the country or around the world, if there is a medical emergency, if they are called upon to help make decisions on behalf of that individual, they would simply be able to use their own smartphone or device, download and see those documents, and not feel that they have to carry those documents with them everywhere they go so that they're always accessible. This is what it looks like if someone is getting a view-only view for the wallet card. They're going to be able to, again, view those documents but not make any changes to the account. If there are additional questions, if your team wants additional training, please reach out to our team. You can also contact us at support@azhdr.org. Additional training videos will be available in your account when you open up the AzHDR under Help, and you'll be able to view additional training videos on these features and how to use them. Thank you.
Great job.